Good morning. My name is Carlo Maria Giovanardi. I'm the president of Italian Federation of Acupuncture Society. It's a great honor for me to participate in the third World Traditional Medicine Forum, and I want to thank for the invitation. I would like to present the outcome of our recent systematic review of the efficacy of acupuncture for the prophylaxis of migraine. This review was supported by my federation, Italian Federation of Acupuncture Society, and the results were published in Frontiers in Neurology in December 2020. As you know, chronic migraine is a big problem. Migraine is considered among the top 5 causes of disability by the Global Burden of Disease study, with about 1 billion individuals affected worldwide. Migraine is the first cause of years lived with disability, both in males and females, in the age group 15-49 years, afflicting people in the active period of their life, leading to reduction of quality of life and relevant disability with significant social consequences. Migraine also leads to important use of healthcare resources at direct and indirect costs and work loss with a significant societal impact. Mean total annual cost per patient by chronic migraine. USA more than $2,500, and in Europe, 2,027 euro. But also prophylaxis and treatment of chronic migraine is also a therapeutic challenge. Despite the progresses in drug treatment, patients are often still unsatisfied because of the insufficient control of pain or the disturbing adverse events that limit patient compliance. More importantly, medication overuse can lead to the migraine chronicization. So I want to show the result of our work. The primary outcomes were the number of days with migraine per month, the response rate, the pain intensity as documented in a headache diary, dropout from treatment for any reasons, and dropout due to adverse events. The secondary outcomes were the quality of life as measured by validated scales, the frequency of migraine attack per month, disability due to migraine as measured by validated scale, the use of rescue medication, and the adverse events. Another question we made, is there a correlation between acupuncture and dose and effectiveness? Which parameters? Very many often in the trial published on the scientific paper, we try that acupuncture is not as high quality, high level. So we have decided to establish standard criteria for composition of data by introducing the concept of adequate dose of acupuncture. Which parameters? The number of points needed during each treatment, the Chi response, the frequency of treatment per week, the number of treatment sections. So the concept of dose intensity has thus been introduced and used to group the studies according to the intensity of acupuncture based on the following criteria. The number of sections, grade 8 versus less 8. The number of acupuncture treated, grade 10 versus less 10. Achievement of the Chi, yes versus no or not reported. So, following these parameters, acupuncture was judged as at low intensity of only one criterion was met, on medium intensity if two criteria were met, at intensity if all of the three criteria were met, subgroup analysis was performed for intensity of acupuncture. We analyze this data according to the grade approach. This is results. About the number of the day with migraine per month, as you can see, we have less day with migraine per month after treatment of acupuncture. The same for the pain intensity. And much more evidence we have about the dropout due to adverse events is in favor of acupuncture. What means that, as we know, that acupuncture has very, very few adverse events if we compare with the use of drugs. The main features of our review, the efficacy and safety of acupuncture for prophylaxis of migraine were assessed and compared to pharmacological treatment. Comparison with sham acupuncture in all its forms was excluded. The aim was to avoid confusing outcome with respect to the therapeutic effects of acupuncture. In addition, a more practical approach was followed to provide more useful evidence as pharmacological prophylaxis is the most common treatment in user care practice. The concept of dose intensity in acupuncture, already introduced by other authors, was used to judge the quality of acupuncture administered in clinical trials. So the conclusion, based on moderate certainty of evidence, we conclude that acupuncture is much more effective and much safer than a medication for the prophylaxis of migraine. By doing so, we answered to the question, what's best for the prophylaxis of migraine, acupuncture or medication? The answer is acupuncture. We hope after this recent review, that acupuncture will be used much more than before for the treatment of this big problem that is a chronic migraine. Thank you very much.